One of the questions we come across from time to time is, what are my sinuses for? I think they're giving me problems, but who put them there? That's a more existential question, so I'll leave that one alone. But if you do find out what your sinuses are for, please let me know, because we're not certain. There are multiple theories. There are theories that they act as a method to lighten the skull. There are theories that they act as a reservoir to increase the mucosa in the nose that secrete certain factors that may be helpful to us. They may increase the moisturization. So the bottom line is, we don't know for sure what our sinuses are for, and we don't appreciate them until they're causing trouble for us. So we do know that when your sinuses get clogged up, then you start to have problems. So now that we know that sinuses, we're not certain what they're there for, what happens when people have problems? Well, we can treat them with medical therapy. Sometimes sinus surgery is helpful. Patients will often ask, why do I need that sinus surgery, or who should consider having it? That's a complex question. We'll set aside the people who purely have nasal airway obstruction, because that's another topic that we could spend a lot of time on. There are a couple of reasons why we'd have sinus surgery. As a global issue, it's designed to open the sinuses, remove any diseased tissue, obtain material for culture if it's required, and leave the sinuses open so that they ventilate better going forward, and that can allow for better topical application of medications. And we'll split those people who have problems or need that into two. One is someone who has recurrent acute sinusitis, where they feel fine in between, so they might get 4 or 5 sinus infections a year. And then the second is someone with a chronic infection or inflammation in their sinuses, something like nasal polyps.